Hey everyone, my name is Junaid McDami. I'm in my last year of anesthesia residency, and I'll be pursuing an interventional chronic pain fellowship in a couple months. So I'm here today to talk to you about why I chose a career in pain and why I chose to do a pain fellowship. And this could be helpful for many of you guys that are early in your residency training or even in medical school when you're trying to figure out what you want to do with the rest of your medical career. So as many of you probably already know, pain is involved across multiple specialties. There really isn't a field of medicine in which patients are not experiencing pain. So as a future provider, this allows me to treat a wide variety of patients from pediatrics all the way to your elderly. The other thing that I realized during my anesthesia residency training was that I was missing long-term patient-physician relationships. So if that's something that you're interested in, continuity of patient care, I think this is a great field in which you're able to provide, you're able to have that, you're able to take care of patients and do procedures and give them medications and see how they improve. So kind of following up on your treatments and seeing how these patients do over a prolonged period of time, I think that that brings a lot of fulfillment and enjoyment. The other thing that I really liked about chronic pain management was that it's a variety of things that you can do. So you're not always just doing procedures and you're not always in clinic. It's kind of a mix of both. So depending on your practice environment, you'll get to do a little bit of both. And I think that brings variety in your day and always kind of keeps you on your toes. You're not always going to just be sitting there in clinic or always just doing procedures. So you're always getting a little bit of both. One of the biggest draws, I think, for me into pain management was that it allowed me to have ownership of my patients. And also that also allowed me to be able to provide patients with alternatives to major surgery. So whether it's a 4 or 5 level spine surgery or a big hip surgery, sometimes patients aren't the greatest surgical candidates or they have multiple comorbidities, or maybe they've failed multiple surgeries and they're still having a ton of pain or poor quality of life. You are able to provide these patients with an alternative, something to help treat their pain, something to help improve their functional status and get back to doing things that they love. And just with my own experience rotating through the pain clinics and seeing patients go from barely being able to walk to walking and golfing and doing all the things that they love to do, I think that brings a lot of fulfillment. And even in the short period of time that I was able to rotate and practice through pain management, I realized that this is something that really brings fulfillment, and ultimately what makes you happy, you'll have a long career in that. So that's something that I really looked at during my residency training and drew me into pain management. The other thing that I noticed with pain management is that there's a lot more research going on than before. So there's new procedures coming out, there's new devices, minimally invasive options to help provide patients with alternatives to major surgeries. So there's a lot of growth in the field. We're not just prescribing opiates and calling it a day. There's way more to pain management than that. There's multidisciplinary care. You're coordinating care with a patient with multiple other different physicians, whether that be surgeons, physiatrists, physical therapists, neurologists. So you're kind of, it's a collaborative effort, and I think that really brings the best patient care when you're working with other physicians and trying to help them out. So those are some of the few things that really drew me into pain management. There's a lot more out there. I think that if you have any further questions, feel free to comment below or reach out to me. Good luck with everything.